Good evening, everyone. This is Rachel Stoller, the forensic nurse, exposing medical crime one misdiagnosis at a time. Today, I have with me the legendary Dr. Kenneth Stoller, medical doctor and author of Incurable Me. We're going to be talking about multiple sclerosis, MS, Lyme disease, and misdiagnosis. So, Doc, I want to start off with a quick story. I remember having a patient that had MS, and I was working in a facility. It was a long-term care. And I remember having to give this patient an injection called Copaxone. And I called the pharmacist and I'm like, what is this poison? Because she was required to have this shot every day. Nothing ever changed. And I would ask her, she was completely with it. And I just felt like I was poisoning her.
Let me take you back 20 years when I thought I was treating my first MS patient. It was a friend of a friend, and I had a big hyperbaric oxygen clinic in Santa Fe, New Mexico. And I said, hey, mi casa, su casa, have your friend come over, because in the United Kingdom, hyperbaric oxygen therapy is the primary treatment for MS patients by MS patients. It has nothing to do with the National Health Service. They have over 60 self-help centers where MS patients can get treated without cost. And these, it was originally started by something called the Oxygen Trust. And the Oxygen Trust was formed after 1983 when a double-blind, randomized controlled, double-blind study was published in the New England Journal of Medicine, showing that hyperbaric oxygen improved the condition of MS patients. Now, that professor at NYU who published that article, apparently he had to dumb down the article several times before they would publish it, because they didn't want to offend the pharmaceutical companies. You following me?
Right.
And nevertheless, once the article was published, the reaction, the ire, the disdain that came towards him was so intense, he lost his tenure and they scrapped the hyperbaric chamber at NYU. Okay, so that was back in the 1980s. But the Oxygen Trust across the pond, I think they opened up 6 centers. Now they have over 60. And they will also treat off-label conditions, on a sliding scale, pretty reasonably priced. And so let me fast forward to the day 20 years ago when I treated my first MS patient. And I put her in the chamber, and she came out of the chamber. To say that she was unhappy was an understatement. And I told her, I'm sorry, this is not MS. This is Lyme disease. Only Lyme disease patients have die-off inside the hyperbaric chamber, because the hyperbaric oxygen actually kills the organism. It's a facultative anaerobe. And if the oxygen level goes above 160 millimeters of mercury, the organism starts to die. And most people who have borreliosis, Lyme disease, will have die-off. Anyway, so that was my first experience, if you will, treating both an MS patient, which really wasn't an MS patient, and a Lyme patient. Now, how many MS patients are misdiagnosed with MS and really have something else? Well, when you think about it, what is MS? Multiple scars in your brain. So the description of the disease doesn't actually clue you in to what it is. It's just saying, it's like if a patient walked to a doctor and says, you're looking at my brain scan, what do I have, doc? You got multiple scars. Yeah, but why do I have multiple scars? Because you have multiple scars. Yeah, but doc, why are they there? Because you have multiple scars. So you see where you can see where that conversation is going to go. Because
the whole misnomer thing, like you talked about with autism, and that's what I try to break down for people. It's like, well, what does multiple sclerosis even mean? So if we look at the
It
diagnostic,
means multiple scars.
right, and
Okay.
then, but that means nothing to me. So I say the diagnostic manual can be a book of curses and a book of spells, because when they misdiagnose you with something and they treat you for the wrong thing with poison, like I was giving this person Suboxone and I see no improvement, and I'm like, is she supposed to get this toxic shot that probably costs $1,500 a day? And then so then you said I treat real MS, and now we're getting into the Lyme disease. So you said the infectious part of that. So Borrelia is a bacteria or
Right.
bacteria?
The Borrelia is in the family of Spiro, um, Spiroche. Oh, I forgot the name of the family. But
Okay.
anyways, there's two major classes of organisms. One is the treponemims, which your syphilis belongs to. One is Borrelia burgdorferi group, and there's many genotypes of that. And one is the Borrelia relapsing fever group, and there's many genotypes in that group as well. Now, I did have a patient, and I talk about her in my book, Incurable Me, which you can get on Amazon, cheap. I talk about this patient. She came to me with MS. Now, of course, with my experience, I go, well, maybe it's MS and maybe it's not MS. Let's make sure you don't have Lyme disease. Well, not only did she have Lyme disease, but she also had chronic active Epstein-Barr virus, which is very common amongst Lyme disease patients.
Mm.
So for the first year, I treated her for her Lyme disease. But none of her MS symptoms improved. And I went, okay, well, this must be because of that damn Epstein-Barr virus. So for the second year, I had her on antivirals that would hit DNA viruses because, Epstein-Barr is a DNA virus. So the end of the second year, none of her MS symptoms were any better. So I said, well, geez, I am convinced that real MS, not Lyme disease MS, but real MS is caused by a virus. And apparently it's being caused by a retrovirus. And we talked about retroviruses on a previous video. So I said to her, would you be willing to try a drug that treats retroviruses just for a week to see what happens? And she said she would. And I put her on a drug that treats retroviruses. At the end of the first week, 50% of her symptoms, her MS symptoms, were gone. And a few weeks after that, a BBC story came on of this MS patient who literally jumped out of her wheelchair after her physician put her on 2 AIDS drugs. And people can Google, this, they can see the woman, the BBC story about MS and AIDS drugs. I contacted her physician and asked, what AIDS drugs did you put her on? And he had put her on Icentra and Truvada. And I have put people on those drugs too. The problem is with MS, assuming it's not Lyme disease caused MS, many people have had MS for so long, their bodies are completely devitalized. So even if you stop the virus in its tracks, they don't jump out of their wheelchair. They have a road of healing to go through to revitalize those bodies. So I warn people about this. I say, just because we're stopping the virus in its tracks, you've had MS for 30 years, you're wheelchair bound, you're not going to have necessarily a dramatic change in your life for a while. The only other problem is, some of these antiretroviral drugs do have serious side effects, and not everyone can tolerate them. But the bottom line is, real MS is probably a retroviral infection. Although there are a lot of people, and I'm sorry, I cannot tell you what percentage of MS people are diagnosed or misdiagnosed. How many of them really have Lyme disease? I don't know I don't know what that figure is, but I bet you it's a lot. Bet you it's a
So
lot.
I heard someone just sent me a message that Justin Bieber announced that he was diagnosed with Lyme, but also, real quick, a lot of nurses are diagnosed with MS. And there was a doctor who was pointing out that they're diagnosed with MS because of the Hep B rounds that they're getting. So I'm very curious to know, like, the patient's vaccine history that you've had with these things, because I always link everything back to the vaccine in a lot of cases.
Well, what I can do is I can send you an article that was published about the French experience with the Hep B vaccine, showing the huge spike in MS cases after they started their Hep B vaccine campaign. And there's no question when you look at the graphs and the numbers that there's a direct relationship. Now, so what's in the hepatitis B vaccine that caused people to come down with MS symptoms? Well, we don't really know. Were they contaminated with retroviruses? Well, that's probably a safe assumption, but we don't know if those retroviruses in Hep B vaccine actually caused their MS, or it was something else in the vaccine that caused the MS.
So what about that Lyme paper that you had with the Lyme-X vaccine?
So what happened with the Lymerix, I think it was called, the Lymerix vaccine, was they developed the vaccine using surface antigen A from the bacteria. And the first people who lined up for the vaccine were people who were very motivated, people who had Lyme disease before, and they didn't want to get it again. So they lined up for the vaccine. And when they got injected with surface antigen A, otherwise known as band 31 on the Western blot test, for many of them, it reactivated all of their Lyme symptoms with a vengeance, and their Western blots lit up like a Christmas tree. So what happened? I'm actually sorry the Lymerix vaccine is not around anymore. I would not use it as a vaccine, but the Lyme organism, like many other bacteria, leaves what are called persister cells. They're like spores of a fungus. You can't kill them. They're metabolically inert, and we don't really know what wakes them up. But apparently surface antigen A wakes them up. And so these poor people who got lined up for the Lymerix vaccine got injected with surface antigen A, and apparently it woke up their persister cells, and they came down with a full-blown case of Lyme disease again. The vaccine became very unpopular, very fast, and was pulled from the market. Now, like I said, I really wish it was still on the market, because we could use it as a provocative test to see if someone has persister cells. But can't cry over spilt milk. Did I answer your question?
Yeah, that's good. And so in regards to testing, what I see a lot of people doing is wasting money on endless medical testing that offers no solution, number one. And number two, that insurance is the deadly trap, because the testing that's needed, I want to talk about the testing that's needed real quick for Lyme disease, so that, you know, if there's a doctor out there that has a MS patient and he hears this video, you know, how do we go about the testing?
All right, so unfortunately, the company that was interested in coming out with the Lymerix vaccine had the CDC remove band 31 and band 34, the two most sensitive bands on the Western blot test, so that when LabCorp or Quest does a Lyme Western blot, band 31 and band 34 are no longer there. Because this pharmaceutical company got, sent out the word, we're going to be using these two antigens in our vaccines, so don't use them in the testing, because that's going to confuse the picture.
And
so when you go to lab, when you go to LabCorp and Quest and get a Western blot, it's not going to have band 31. It's not going to have band 34, even though in like some chronic Lyme disease patients, those are the only ones that might be positive after many years. Um, right now, really, the gold standard in Lyme disease testing is a lab in Milpitas, California called IGeneX. And they have a panel called an immunoblot. And that is really the only reliable Lyme disease test. Now, there is a direct test looking for the DNA of the organism. The problem is 70% false negative rate. So if you test positive, it means something. But if you test negative, it doesn't really mean something. So here we are in the year 2020. Lyme disease testing is not perfect. And I do know there's a lot of people, and this has been published in the medical literature, who are seronegative. They do not test positive on the Lyme disease test, but they still have Lyme disease. So the main drug that I use to treat Lyme disease can often act as a provocative agent. And I tell people, look, you look like a duck, you walk like a duck, you talk like a duck. Would you mind taking this drug for a few days and tell me what it does for you? And since most Lyme patients have die-off reactions when the organism is being killed, I use this drug as a litmus test. And I say, you would not be reacting to this drug if you didn't have Lyme disease. So,
Right.
in those people who are, kind of, do you have it? Do you not? I go, let's solve the problem. Take this drug for a few days and tell me what happens. Did I answer your question?
Yeah, so there's a scientist by the name of Irene Caesar, and I believe she lived out in Connecticut at one point. And so I guess there's a lab out in Connecticut, and she was basically exposing a lot of corruption and different things, and she had Lyme disease, but there's been a lot of talk about this basically weaponized stuff, and I don't trust vaccines. I will never get another vaccine as long as I live. But what's the story with the whole Connecticut lab and them playing around with organisms, and then the population like booming with Lyme disease, and like you called it an ignored pandemic?
Well, the lab that you're talking about actually is on Plum Island, which is part of New York. Not, it's 10 miles away from Lyme, Connecticut, but it's actually, I think, considered to be part of New York. Now, Lab 257 on Plum Island was an animal biowarfare facility. And from what I can tell, and books have been written about this. There's a book called Lab 257, and there's a new book called Bitten that talks about the animal biowarfare lab on Plum Island. Apparently, the plan was to wipe out the livestock of the Soviet Union using these weaponized insect vectors. And I guess some smart general said, if we wipe out their livestock, who's going to feed them? We're going to be the ones feeding them. This plan is no good. So they abandoned the plan. But whether you believe that or not, and you should read Lab 257 and that new book called Bitten before you make up your mind, was an article published saying somewhere in the last 200 years, the virulence of the Lyme organism really increased significantly. So they were able to temporize it down to 200-year span. But in all likelihood, we're talking about 70 years ago when it was weaponized. So Lyme, the Lyme organism has always been around. Heck, that Iceman they found in the Alps had Borrelia in his bone marrow, but he didn't have weaponized Borrelia in his bone marrow. So there's a real, chance that the organism was virilized and weaponized on Plum Island, based on what I've read. And I asked in 2006 when I was in Washington, D.C., trying to get Congress to pass a law that would allow autistic kids to get treatment. I asked somebody who was a congressional aide with the Appropriations Committee, which is like the most powerful committee in Congress because they're the ones with the purse. They decide who gets the money. And I said, I don't understand what's going on at the CDC, what's going on at the NIH. Why is everyone pretending that Lyme disease is not a problem? And he said, look, whenever the government has played a role in causing a problem, they will obfuscate it. And if it's true, and I'm not saying it is, but if it's true that there was a lab on Plum Island weaponizing this organism, you can understand why Lyme? What's Lyme? There's no Lyme. Lyme's a hoax. And that's where we are today.
So how do you think the population is getting infected with Lyme disease?
Well, I'm sure the majority of people who get infected with Lyme are being bitten by ticks, and I don't remember being bitten by a tick. Well, you remember if you're getting bitten by an adult tick. You don't remember getting bitten by one of those tiny, tiny little nymphs. They're so small. They're the size of a pinhead, these immature ticks. And they're probably doing most of the biting. And they're probably doing most of the infecting. But Lyme disease is a potential sexually transmitted disease. And you can pass it on congenitally. And the problem is almost 4 decades of research into this very complicated infection have been lost because all the money has gone into trying to come out with a vaccine for this illness. This illness does not fit a vaccine model. A bacteria that leaves persister cells, it will not fit a vaccine model. And if it did, why isn't there a vaccine for syphilis?
Well,
There's a good disease to have.
I think where people really need to understand is where we're at is you don't want anything that's coming by way of vaccine, number one, because the CDC and FDA have already been exposed. All right. There's all this corruption. And the last thing I want to do is inject anybody with a pre-filled syringe that comes from pharma. And that's why I stepped out of nursing altogether, because when I observed all of this stuff going on, a lot of us nurses would sit there and say, we feel like we're poisoning these people. They're not getting better. Nothing's changing. And then I'm supposed to be this, this drug pusher. And the last thing I wanted to mention, well, what is Bartonella then? Can you just clarify that?
So most people, when they get Lyme disease, don't just get Lyme disease. They get a host of co-infections along with Lyme disease. Bartonella is called cat scratch fever. I would say almost all the cats in the southwestern United States are infected with Bartonella. And it's one of the infamous co-infections that you can get with Lyme disease. Yes, there are people who have Lyme disease who just have Lyme disease. They don't have Bartonella. They don't have Babesia, which is a protozoal infection. They don't have Ehrlichia. They don't have Mycoplasma. Those are the big 4 co-infections that can come along with Lyme disease. So, and you have to be aware of them because a Lyme patient may have more going on than just Lyme disease. So when they say, oh, we're just going to treat you with 3 weeks of doxycycline, not only is that inadequate for Borrelia, but it's not going to take care of the co-infections. But the medical community has been kept in the dark about this. The CDC, just looks up in the CDC for years was just saying, there's only 30,000 new cases of Lyme disease every year. And then a few years ago, they said, okay, there's about 300,000 new cases of Lyme disease every year. And when they made that change from 30,000 to 300,000, I went, oh, someone's come out with a vaccine. So they're ramping up the numbers so that they can market it. That's their only motivation, because you were like, why would they suddenly change the numbers that drastically? Somebody must be coming out with something to market. So, But still, 300,000 new cases of Lyme disease a year. Multiply that by 20 years and see how many people we're talking about. And why isn't this a national emergency? 300. I'm sure it's more than 300,000, but let's say it's 300,000 new cases of Lyme disease because the CDC says so.
Right.
That's still a national emergency. Oh, Lyme disease, it's just a nuisance illness. Don't worry about it. Okay. No, acne is a nuisance illness. Lyme disease is like having syphilis on steroids. It is not a nuisance illness. The thing is, if you get Lyme disease, you want to hope it stays dormant in you for decades, which it can do. Lyme disease can stay dormant for decades after you get infected. But it can also drop you like that. So my most favorite Lyme disease patient was a 24-year-old fellow who came to see me. He had had a psychotic break and was hospitalized the year before. And of course, I tested him for Lyme disease and he was positive, and he kind of groused about having to take all these medicines. I don't feel sick, he said. Why should I take all these pills? I go, well, but remember last year when you had your psychotic break and you were hospitalized? That was last year, he said. It only happened once. What are you doing next Tuesday? I said, because this infection can turn on you like a dime. Anyways, when he went on his antibiotics, he said, you know, doc, these antibiotics are making me feel emotionally better. And I said to him, antibiotics do not make you feel emotionally better unless they're killing something eating your brain. Anyways, he ended up being my best patient. I got him into remission in 3 months, which is like the fastest I've ever gotten someone into remission. And I don't say cure because we have no test. We have no good outcome measure. We have no test for the persister cells. So when I put a patient, I say, you are now in vigilant remission status. And whether it's 2 days into the future, 2 weeks, 2 months, 20 years, if your Lyme symptoms start coming back on you, you're to take my favorite drug, start it, and ask questions later. I hope I answered your question.
Well, that's incredible. Oh my gosh, Doc, I thank you so much. We're going to wrap it up. And brothers and sisters at home, if you have Lyme disease or anybody you know has, MS or Lyme disease, feel free to contact Dr. Stoller. He's been in this game for a long time, hbotsr.com. Check out his book, Incurable Me, on Amazon. And thank you so much for listening to this message, Doc. Thank you. Signing off.